Hello, Brittany.
Hi.
Hi, my name's Amanda, and I'm a nurse practitioner student at Penn State University in their NP program. I'm here today to get some of your history and find out about some of your ailments that you're having.
Okay.
So, can you tell me what brought you into the office today?
Yeah, I've been having like a sore throat, just a sore throat mostly.
Okay. When did this begin?
I noticed it like 3 or 4 nights ago. It started then, but in the morning I really noticed it, but I just thought it was from sleeping under my window fan. So I kind of let it go, and then it got a little worse that night, and then it's been getting worse ever since.
Okay, so this has been kind of affecting your everyday life and activities.
Yeah, I'm a student and I work, and I had to miss work.
Okay.
And I just don't feel good.
Okay. Would you consider the pain you've been having mild, moderate, or severe?
It started out as mild. It's definitely been getting worse though, so I would say like moderate to severe by now.
Okay. I'm just going to ask you a few questions about your past medical history.
Okay.
Have you ever had any illnesses as a child?
I had like chicken pox and appendicitis.
Okay. Are you up to date on your immunizations that you know of?
Yeah, I just started a job a little bit ago where we had to provide all that documentation, so
Okay.
I know my shots are up to date.
Okay, good. Have you been diagnosed with any medical conditions?
Recently, polycystic ovarian syndrome. I was diagnosed with that. I've been diagnosed with like depression, but I don't think I am.
Okay. Do you have any allergies that you know of?
Oh, and I have chronic migraines. Allergies. I have like hay fever. Seasonal allergies. I think I'm allergic to like some cats.
Okay. Do you take any medications currently?
I take spironolactone, I think that's what it's called, for acne twice a day, and I take methylphenidate Concerta once a day. That's
and
it.
You take that for?
That's ADD. I also have that.
Okay. Do you smoke or drink currently?
No, I don't smoke or drink ever.
Okay. Do you exercise regularly?
No, I don't like exercise.
Okay.
And I'm not going to start.
Are there any medical conditions that run in your family or that have caused the death of any of your family members?
I do have Alzheimer's on both sides. My maternal grandmother and my paternal grandfather both had Alzheimer's. And that's kind of, what led to their death. I have dementia in my paternal grandmother, as well as she had type 2 diabetes. I have alcoholism that runs pretty high in my family. My grandfather on my mother's side had pancreatic and prostate cancer, but I think that's it as far as cancers.
Okay, that's good. I want to ask you a couple questions about your social history. What are you doing for a living? I know you said you're working and going to school. What's your...
I work at the Penn State Hershey Breast Center. I am basically a secretary there.
And then you're in school?
I go to school at Penn State. I go through their online program.
Okay.
I'm a psych major.
So you're pretty busy.
I'm busy, yes.
Are you married or have a boyfriend?
No. I just actually moved out of my relationship, and I live on my own now in my own apartment.
Okay.
No kids.
Okay, good. Is there anything causing you stress at the current time that you know of?
Not outside normal school. I mean, it's stressful to not be able to like go to work because my throat hurts.
Yeah.
But I talk on the phone all day, so it's at work. So, and I talk to patients. So when you have a sore throat, it just makes it worse.
Okay, understandable.
That's stressful.
Do you have any particular religion you practice?
I was born and raised Catholic, so I wouldn't say that I'm practicing, but I do have a relationship with God. I pray every day. Often.
Okay, good. I'm just gonna ask you a couple questions about different systems of your body.
Okay.
Generally, how would you describe your state of health in general?
Good. I
Okay.
feel healthy.
Okay, good. Have you had any recent changes in your weight or any fatigue that you've noticed?
I am tired often. My weight, before I started the Concerta, I was taking amphetamine, dextroamphetamine. I'm on an extended release of Concerta, but with the Adderall, I did lose a lot of weight. It suppressed my appetite a lot, and overall, I've probably lost like 50 pounds, but
In the last 6 months?
in the last 6 months, I've probably lost like 20 to 25 pounds,
Okay.
maybe.
Any fevers have you been having?
I actually did have a fever 2 nights ago with my sore throat,
Okay.
but it was just a low one,
Um,
99.9 or something.
Okay. As far as your skin, have you noticed any skin lesions, any rashes, any changes in your skin texture or mold?
No.
Okay,
I was
good.
just at a dermatologist, and I was concerned about a mole, but he checked it and it's fine.
Okay, good. Do you have headaches?
Yes, often.
Okay.
They've actually been getting better. I think my living situation before contributed, a lot with the stress, but I haven't had a migraine, knock on wood, in a while, so.
Okay. Any dizziness or lightheadedness?
Sometimes when I stand up, after like being crouched down, like if I'm shopping and I'm like crouched down and I stand up, I get pretty lightheaded and I have to kind of stop for a couple seconds, but.
Okay. Have you had any changes in your vision, any blurry vision?
No.
Okay. Do you wear contacts?
I do. Sometimes my eyes get dry from that, but
Okay.
I probably leave them in for too long, so.
And you regularly see your optometrist?
Yeah, I was just there recently.
Okay, good. Have you had any issues with your hearing or any earaches?
No.
Okay. Have you had any postnasal drip with this?
Yeah, actually a little bit with, not
Okay.
a whole lot, but.
Any difficulties breathing?
I mean, I have like a little bit of tightness in my chest, but I don't feel like I can't breathe.
Okay. Have you noticed anything in addition to the sore throat, like ulcerations in your mouth, any bleeding gums, anything like that? Okay.
No.
Any problems with your teeth?
No.
You see your dentist?
Yeah,
regularly?
I do.
Okay. Have you noticed any swollen glands in your neck?
A little bit in my neck. Not as bad as like I've had before, but I definitely feel like tenderness.
Okay.
in my neck.
Any pain or stiffness with that?
I mean, it's a little bit painful. I kind of always have neck pain in the back of my neck. I always feel like I need to crack my neck, so
Okay.
I always kind of feel that though.
Okay. Just in generally, as far as your breasts, do you perform
Yes, I do.
self-examination?
I work at the breast center. I can teach you.
Okay, good.
I'm sure you know.
Do you have any lumps or any changes that you
No.
noticed? Okay, good. Have you had any recent chest pain or shortness of breath?
No.
Okay, good. Any palpitations of your heart?
Nope.
Okay. Any history of high blood pressure recently or anything
Nope.
like that? Okay. Have you been coughing anything up with your recent sore throat?
Yeah, it's nasty, I know, but a little bit, yeah.
Okay. What color?
It's like
normally?
clearish, yellowish, kind of. It's
Okay.
gross.
Is this normally consistent or in the mornings? Or
It's
at
really
night?
more in the morning than
Okay.
anything. I think like once I wake up, I'm like, ugh.
Okay. Have you had any nausea or loss of appetite?
No, not really related to this. No,
How often do you typically have bowel movements?
like every day, pretty much.
Okay. And any changes recently in your bowel habits?
No.
Okay. Have you had any urinary frequency, any urgency, nothing
Nope.
abnormal?
Nope, no.
Okay. As far as, I just have a couple questions about your sexual history.
Okay.
Do you have normal periods normally?
Yeah, I do.
Okay, once a month.
Yeah, once a month, pretty
Okay.
much. With the polycystic ovarian syndrome, I was taking birth control to regulate that. I've since gone off it, but
Okay.
so I'm not sure
Yeah.
if that is going to change it. It might, but
Okay.
we'll see.
Are you currently sexually active?
No, not at the moment.
Okay. And when you are you using protection?
Yes, I am.
Okay, good. When was your last menstrual period?
I think like 3 weeks ago.
Okay.
Probably soon.
Have you been having any discharge or any pain anywhere?
No,
Okay. Have you ever been pregnant before?
no.
Okay. Any history of sexually transmitted
No.
infections?
No, none of those.
Good. Do you ever notice any easy bruising?
I bruise very easily.
Okay.
I always feel like a battered woman at work. That one's gone away, but I noticed when I was moving, just from I would see a bruise and I had no idea where it came from other than probably moving boxes and things, but often I bruise without even knowing how I got it. So
Have you ever been diagnosed with any anemia or anything?
I can't remember if I was diagnosed officially. I remember a long time ago somebody recommending an iron supplement, but I don't. I'm pretty bad about taking pills.
Okay. Just a couple questions. Have you had any excessive thirst or hunger, any sweating?
Not excessive.
Okay. Just asking because that could be a sign of some type of endocrine disorder. So we asked.
Yeah, I mean, I get thirsty sometimes, but I don't drink enough water, so that's probably why.
Okay. As far as your skeletal system, do you have any joint pain currently?
I do. I have pain in my hip pretty bad. I was actually gonna look into going to see somebody about that. This kind of took the...
How is that, do you notice anything that triggers it or anything that...
I notice it most when I go to stand and put weight on it. It's just my right hip and it's kind of like a shooting pain in like my inner hip. It's not really... I don't feel it all the time. I don't feel it right now, but when I go to put weight on it, and after like a couple seconds it subsides. It's just initially it hurts a lot.
Okay, so just like a shooting pain.
Yeah, a shooting pain
Okay.
just when I put weight on it initially.
Okay. It hasn't had any limitations on your activity though?
No, not really, no.
Okay.
It's a pain. I mean, I haven't tried to be active,
Okay.
but I'm sure.
Have you had any dizziness or memory loss?
No.
Okay. No balance issues that you
No.
can remember? Okay. Any depressive thoughts, moods?
No.
Okay. Any stress that you feel that you can't handle right now?
No, nothing else. I mean, breaking up with my boyfriend is stressful in its nature, but I'm okay with the decision and I'm moving forward, so.
Okay, good. No other emotional issues or anything like that? Okay, good. Well, I'm thinking that you probably just have some sinusitis going on. I may do a culture just to make sure you don't have any strep. But otherwise, probably just do that, maybe a round of antibiotics.
Okay.
But I appreciate you letting me talk to you today and sharing your information with me.
Sure.
And I hope you feel better.
Thanks. Thanks so much. It was nice to meet you.